Good morning, class. We are going to consider a topic today that is called spatial senses. I am Dr. Salis Ahmed Ibrahim, an associate professor of human physiology from Bayero University, Kano. What are spatial senses? They are organs in the body that helps individual to identify his own environment clearly and very well. They include the eye, the ear, the nose, and the tongue. So we consider the eye first. Eye is a vital organ in the body which embryologically developed from the ectodermal mesenchyme. It is highly delicate but well protected within the bony orbits. The main functions of the eye include vision. Number 2, learning. And number 3, equilibrium. Other subfunctions include diagnosis of different diseases like diabetics, like hypertension. Eye also protects the body because it is with the eye that you can see the harmful substance or the harmful object that comes to you, and then you try to run away or you protect yourself. Eye is also used for communication. It's used for cosmetics. Then we also look at the area where the eye lies. The eyes lie within the two bony cavities in the anterior portions of the face. The shape of the orbit is a four-sided pyramid made up of apex, the base, the roof, the floor, medial and lateral walls. And dimensions of the eye is that the height is 35 millimeter, the width is 40 millimeter, and the depth is also 40 millimeters. Eyes are protected by bones. There are 7 bones that protect the eye. We have frontal, maxillary, zygomatic, lacrimal, ethmoidal, sphenoidal, and palatine bones. These bones, they form a roomy structure that help to protect the eye against any injury. There are also muscles, 7 of them that anchor the eye firmly against the bony on the bony walls, so that no matter how injury comes, you hardly see the eye coming out. These structures include the levator palpebrae superioris that lift the upper lid upward. We have the superior rectus, also help to lift the eye upward. We have inferior rectus, it draws the eye downward. We have medial rectus that shift the eye to the medial side. We have lateral rectus that shift the eye to the lateral side. We have superior oblique muscle that help to rotate the eye from the inferior to the superior direction. And we have inferior oblique, which help to rotate the eye from the superior to the inferior direction. Now, what are the orbital contents? Inside the orbit, you have the eyeball. We have the cranial nerves. That includes the second cranial nerve, which is the optic nerve, the third cranial nerve, which is the oculomotor nerve. We have the fourth cranial nerve, which is the trochlear nerve. We have the sixth cranial nerve, which is the abducens nerve. And we have branches of ophthalmic and maxillary nerves. We have ophthalmic vessels. We have ophthalmic inferior orbital vessels. We have superior and inferior branches of the ophthalmic vein. We have lacrimal branch of the middle meningeal artery. We have facial and fat. We have fascia and fat within the bony orbit, and we also have lacrimal gland and lacrimal sac. Now, the structure of the eye is such that the eye is a globular structure, and it is made up of three layers. These three layers include the sclera. This is the sclera, which is the outer covering of the eye. This sclera continues with the cornea in the anterior portion. The cornea is a transparent structure that allows the light to pass into the eye, while the sclera is a top fibrous structure that protects the eye, and the two of them they form the corneoscleral cord, and they meet at a point that is called the limbus. This is where we call the limbus. It's an annular junction where the cornea and the sclera meet. Then we have the middle layer that is called the uveal tract. Uveal tract consists of the choroid, the ciliary body, and the iris. They contain highly vascularized blood vessels, and they normally function in nourishing the eye. The inner layer is called the retina. This retina contains nervous tissue, and it is from this retina where images are captured at the level of the fovea centralis. This is where the fovea centralis is the area where you have the highest acuity. So the whole fibers, they will now converge and enter the optic disc and into the brain. This is the optic nerve. This place is called the optic disc or the blind spot because it has no photoreceptors. Now, this eye, as it has a crystalline lens which divides the eye into two compartments. Posterior compartment. This posterior compartment contains vitreous humor, which is a clear gelatinous fluid. Another compartment is the aqueous humor compartment, and this compartment is divided into two by the means of the iris. This iris is a continuation of the uveal tract there, the ciliary body, and it divides the anterior compartment into anterior chamber. This is the anterior chamber and the posterior chamber. They contain aqueous humor, and this aqueous humor is produced from the ciliary body. The ciliary body, having produced the aqueous humor, it comes into the posterior chamber. From there, it will exit the posterior chamber through the annular ring that is called, or opening that is called the pupil, and then into the anterior chamber. It is from the anterior chamber the aqueous humor will now drain into the angle of the anterior chamber. This is what we call angle of the anterior chamber. Inside this angle of the anterior chamber is formed by the cornea in front and the iris in the posterior part. So this junction is called the iridocorneal junction, or the angle of the anterior chamber. It contains a canal where aqueous humor is drained. The canal is called the canal of Schlemm, and this will help the aqueous humor to leave the eye and enter the venous sinuses of the brain. The lens is anchored by the suspensory ligament which attach to the ciliary body, and when the lens contracts, it's going to increase the magnification of the eye. Now, In front of the cornea, you have the eyelids, the upper and the lower eyelids. They help to blink the eye so that it clears all the debris from the eye. And beneath the palpebral, beneath the eyelid, you have a conjunctiva, which is a thin sheet of membrane that lies the inner part of the cornea of the eyelids, both upper and the lower eyelid, and now is reflected onto the cornea so that it helps to protect the cornea too, but it stops at the level of the limbus. This is a structure, briefly the structure of the eye. I look at the description as we continue along. Thank you very much. These structures include the eye, the ear, the nose, and the tongue. Now let's take the eye for example. Eye develops from the ectodermal mesenchyme. It is well protected by the bony prominences of the face and
Go ahead, tattauna.
okay,
In kai tari duk
okay,